Lately in the media, there's been increased attention given to sleep apnea, and for good reason. This is a dangerous condition that can rob years off a person's life. The average life expectancy of a patient suffering from untreated sleep apnea is only 55 years. Dentists are uniquely qualified to screen patients for this deadly condition. There are several indicators of sleep apnea that can be seen in the mouth. These include marks on the side of the tongue, large tonsils and uvula, a narrow arch form, presence of an overbite, or a high narrow palate. So what exactly is sleep apnea? When a person's sleeping, the tongue can fall back into the throat, blocking the airway. When the body's oxygen level decreases to a critical level, the person wakes up briefly to move the tongue and take a breath. This can take place up to 150 times an hour in the case of a severe sleep apnea. Imagine the toll on the body. Having your sleep interrupted so many times a night, not to mention the effects of oxygen deprivation throughout the night. Other predictors of sleep apnea are a neck circumference greater than 17 inches in males, snoring or gasping for breath as reported by a bed partner, or a high body mass index. Sleep apnea should be treated by a sleep physician. He'll recommend a sleep study that may be done in a sleep center or an ambulatory monitor at home. Depending on the results of the study, the physician may recommend a positive airway pressure device, called a CPAP, an oral dental appliance, or a combination of both. For mild to moderate cases of sleep apnea, or for patients who don't use their CPAP, an oral appliance can be made by a dentist. These appliances are effective because they advance the mandible slightly, increasing room for the tongue and making the airway larger. Recognizing the signs of sleep apnea is just another example of how dentistry can improve the quality and length of patients' lives. The statistics are scary. 17 to 20% of adults are thought to suffer from sleep apnea. Patients with mild sleep apnea are over 23 times more likely to have a heart attack, whereas with smoking it's only 11 times. Sleep apnea increases blood pressure, which can lead to stroke. Moderate to severe sleep apnea patients are 3 to 4 times more likely to suffer a stroke. A study at UCLA also found that sleep apnea patients are 3 times more likely to develop diabetes.